I'm always aware that I'm standing between you and going home, so I will be brief. And I'd just like to say good evening, ladies and gentlemen. And it is fitting to hold this Greater Western Sydney Health Forum in Parramatta, not just because it's the capital of Western Sydney, not just because it's my electorate, but simply its proximity to Westmead Health Precinct. And Westmead, as we know, is one of the largest or the largest health precinct in Australia, and I think it's outstanding for its clinical care. When there's difficult cases in Western Sydney, where do they go? They go to Westmead area. It's a centre of international research, and it's a centre of teaching excellence. So I think when we first started, we heard from Ray Williams talking about 1 in 11 people, 1 in 10 people live in Western Sydney, and certainly we do have challenges ahead of us. In the next 25 years, another 1 million to 2 million people will live in Western Sydney, presenting its own challenges. And tonight we've heard some of those challenges. And can I say that we may not always have the perfect answers or every solution to the problem. I think Jillian Skinner's comments were quite profound in the way that there is no more important portfolio than the health portfolio to the state. It is an $18.3 billion annual portfolio with consuming 28% of the state's budget. We face increasing challenges of an increasing population, an ageing population. The costs of healthcare are going up. And certainly I think the approach where patients are put at the centre of the model makes the most sense. Tonight we've heard some fantastic examples of things that we've been doing in the Greater Western Sydney areas. I especially like the professor who described getting more people through the Auburn clinical practice and that foresight to continue on that, and the doctor from Westmead talking about generic therapy to help some of our youngest and most vulnerable. Can I also say that I think there is a lot of good things to happen. I think we've been in government for some 18 months. We've implemented local health districts. We're looking at new models of healthcare and better use of the existing dollars that we have to stretch that dollars a little bit further. Finally, I'd like to thank Minister Skinner and Minister Humphries for coming along here tonight and actually being so approachable to any question. And can I just say to you that they were the tough questions, you know, and the questions tonight make question time in Parliament look like kindergarten. So well done, ministers, on your... Much more informed, that's for sure, much more informed, except for the questions I asked you, ministers, of course. So that's... Can I also thank our health professionals, our leaders, our dedicated leaders on either side of us who have taken their time out to be. And I think it's really essential. It's a wonderful place where the leaders of our health services and our top professionals are able to sit here in Parramatta Town Hall and listen to the genuine concerns of the community. Certainly a thanks to Jim Taggart, our MC tonight. Thank you, Dr. Taggart. And no event would ever go without acknowledging my parliamentary colleagues, whether it's Mel Gibbons from Menai, whether it's Andy Rowan from Smithfield, whether it's Stuart Ayres from Penrith, whether it's Kevin Connolly from Riverstone, whether it's Brian Doyle from the Opal of the West, or even Bart Bassett hiding up the back there being incognito. So thank you for coming along, and I should assure you that you have a very committed team of MPs, if I may say so, to the health concerns, and a lot of concerns in Western Sydney. But finally, and most importantly, a big thank you for all those who attended tonight, because without your attendance, things like this couldn't happen, and we couldn't get the feedback, and we couldn't be listening. So thank you very much. I wish you all a safe journey home tonight.